Good morning and welcome to a COVID-19 talk with local health authorities. We have a new doctor in the house, Dr. Maria Rivera representing Harris County, Dr. David Persse representing the city of Houston, and in our studio audience is Kathy Fenninger, past president of Rotary Club of Houston. She's here to commemorate our one-year anniversary of COVID-19 talk with local health authorities. So welcome, Kathy, to the program. We're going to start off with questions. After you're vaccinated, if you're in close contact with an infected person, what should you do?
Well, you don't need a quarantine. That's the one thing. So wash your hands, wear your mask, and go about your business, I would say.
Yeah, and the question also comes about what do you do? Do you have to get tested? And the CDC is recommending if you have symptoms, you should still get tested. If you're completely asymptomatic after you've been exposed, you don't have to get tested either anymore.
Okay. Over 120 global cases have been confirmed. Global cases have been confirmed. TMC said their RT number is about 1 and positivity rate of hospitalization seems stable. Have we plateaued? Please update us on local numbers.
So, I was looking at the numbers this morning. I don't think we've plateaued yet. I think we're actually still coming down.
Yes.
Looking at, so, it's kind of hard to say when you plateau because you can only see that in the rearview mirror, right? But I think that we're actually still coming down a little bit.
And our positivity rate was what now? Last time,
yeah,
has it gone down past
9.8?
9.8?
Yeah.
Okay.
Yeah, no, I agree. And I think that the goal is to keep doing that, to keep going down, keep wearing our masks, keep washing our hands, keep doing all that we're doing so that trend continues.
But testing is down significantly though.
That's true too, yeah.
Okay. According to the CDC, counties that open up to no masks in restaurants have seen increased infection and death rates, and those requiring masks have slowed transmission. I have friends who do not believe this is possible and said there is no proof, and if we keep restrictions, it will take longer to reach herd immunity. Please weigh in. I guess they want everybody to get affected.
I think there's places that have tried that and it hasn't gone over so well. So there's places in Brazil where there was around 65% of the population was already infected. They thought there's no way we're going to have a second wave. They still did. They had a huge wave, and now more than 80% of the population has been infected at some point, but it didn't prevent even more infections. And so I think the theory of herd immunity and getting as many people infected as possible as a way to control COVID-19 is not a good one, and I think unfortunately that's been proven. And so we still have to keep wearing our masks, kind of the same thing that we're going to keep saying over and over, get the vaccine when you can.
Yeah. Yeah, I think the way out of this is through vaccine-induced herd immunity, not infection-induced herd immunity.
Yep, absolutely.
I know multiple people who have had the virus twice. Have you heard of more than twice, or at that point, are you pretty much immune? You just said no.
Yeah, no, we're seeing it. It's not. I wouldn't call it common, but it's enough that everybody's hearing about it.
Italy has experienced a rebound, have reinstituted strict measures, and will lock down for Easter weekend. What would a surge have to look like here for a reversal of mandates in Houston?
Yeah, I think that's a hard one, right? Because it's not necessarily up to us always. It's often up to the state. But I think we continue to recommend all the same measures. We're still in this. We're seeing the decrease in cases as we're saying, but unfortunately, sometimes it's not entirely up to us.
Yeah, that's a question for the governor.
Yep.
But if it were up to you, and I'm putting you on the spot, what would you do? What would you have done?
Wow, that's a good question. I don't have a specific answer to that. I mean, because there's a lot that goes into making that decision. There's a lot of consequences to shutting things down, right? So I'd have to think it through.
Yeah, absolutely. And I think that right now, luckily, we're not seeing another surge, and so we can do the best that we can in trying to prevent that from happening. So like Dr. Persse was saying, the vaccines are out there now. Get on as many wait lists as you can. As soon as you're eligible, get the first shot that's available to you so that we can try to get ahead of it so we don't have to go into any further lockdowns.
As an example why that's complex is because right now the numbers are all looking good, right? They're all good except for the TMC is still overflowing their ICUs. They're still in the phase 2. So while the hospitalizations are going down, the new infections are going down, the hospitals are still dealing with a huge number of COVID patients, particularly in the ICU. So the whole thing is about saving lives, right? And so, people get infected. Most of them, fortunately, do fine, right? About 1 in 50, using my back of the napkin math, about 1 in 50 wind up hospitalized. But 10% of those die, right? So if it's about saving lives, we got to get the numbers down pretty low. So I know that's a really complicated question.
And we see that a lot of businesses still are requiring masks inside there.
Right. And I applaud them.
Yep,
quite honestly.
I agree.
Texas is still lagging in vaccines. What is the current situation with numbers received and distributed?
I look to you for that answer.
I took a peek yesterday, and it may seem like we're lagging, but if you take a look at the numbers of the vaccines that we've received, especially the vaccines that we received here in the county and that we've received here in the city of Houston, we've distributed most of those vaccines. And the only reason there always seems to be a little bit of a gap is because we have scheduled appointments that are still coming up in the next couple of days, but not necessarily that they're just sitting there. And so I think we're doing the best that we can, and I think those numbers will continue to go up. But like Dr. Persse, I don't have the exact numbers for all of Texas at the top of my head.
Yeah, the other thing too is that when those calculations were made, they were based on, I think it was 2018 population and not necessarily the current population of Texas. And that's really been in dispute between the state and the federal government. Last weekend, you added faith-based locations for distributions. What are the current sites? Well, what they're referring to is the fact that we went to 2 African-American churches for vaccine administration last weekend. This weekend, we're actually going into the East End and to one of the Catholic churches. And of course, one of the purpose of that actually is to go into vulnerable communities, going into trusted institutions to ensure that a vaccine is available within those communities. Have you considered a 24-hour vaccine site as supply permits?
I think that right now we've gotten so efficient that even if we had a 24-hour site, I don't know that we would have the number of vaccines to be able to even have enough vaccines for a 24-hour site. So for example, even at NRG, and Dr. Persse can tell you the same thing, the process is so efficient that the hours have been cut, but the number of vaccines is still a huge number. And so if we get a tremendous increase in supply, then I think it's something that we can talk about. I don't think it's entirely off the table, but I think right now with the supply that we've had, the teams have gotten so efficient that we can actually administer them in shorter periods of time.
Thank you for joining us for COVID-19 Talks with Local Health Authorities, sponsored by the Rotary Club of Houston. We'll be right back.
Houston, we have a problem, more like a pandemic, and now it's all of our responsibility to make sure we end it. So this is a declaration for us, 3rd Ward to 5th Ward. We can't afford to lose this. It doesn't matter which state open first. We cannot allow this virus to get worse. Memorial, Main Street, A-Leaf, Acres, Home, Sugarland, and Sunnyside. Trust, we know it's hard to stay inside of your home, but you are not alone. And when you do leave, mask up. If not for you, then for other Houstonians. River Oaks, West U, Heights, Higham Park, Galleria to Greens Point. May we point out to you that keeping your distance is still the safe thing to do. Remember, there are people on the front lines. Show them we still have their best interest in mind. East End, 2nd Ward, Midtown, and MLK. And if we didn't name you, the same is true. We all have a job to do. Please wash your hands and get tested. It's time we invest in this great city, because where others may not have a solution, this is Houston. And we must protect the H.
I hear someone go, "Didn't it come from you guys?"
Strangers cough at me.
Move away from me.
Someone spit towards my direction. All the stereotypes that we've worked so hard to break are just going to be reversed. And I won't let that happen.
We all have to play our part.
I donate my plasma.
I've been making masks.
We deserve respect as much as everybody else.
I'm a firefighter, not a virus.
I'm a mask maker, not a virus.
I'm a nurse.
I'm a delivery woman, chef, a neighbor,
Artist.
Bus driver.
I'm a doctor.
Fight the virus.
Fight the virus.
Todos tenemos nuestras pequeñas rutinas. Cosas que hacemos casi sin pensar y que no podemos olvidar. Que repetimos una y otra vez por nuestra seguridad y por la de nuestra familia. Ahora tuvimos que añadir algunas más, para proteger a todos. Cada día cuenta. No te olvides. Ponte la máscara. Distánciate. Lávate las manos. Hazte la prueba. Hazlo siempre. Haz que cuente.
Wash your hands, avoid sick people, and touching your face. There are everyday actions to help prevent the spread of respiratory diseases. Visit cdc.gov/COVID-19. Brought to you by the National Association of Broadcasters and this station.
Welcome back to COVID-19 Talk with Local Health Authorities, sponsored by Rotary Club of Houston. Long question here, several comments. Israel has inoculated more than 55% of their population with at least one shot. They reward people who get a vaccine by offering free food and even vouchers for drinks. Their model is to go where people are and give positive reinforcement. How about a mobile unit at bars on a Friday night? That sounds more like what we do with our outreach clinics related to HIV, STD. Yeah. You saying yeah? That's a good idea. All right, come on, y'all. All right, all right. I'll go on to the next question. Yeah, good idea. Does the level of side effects you have impact the ability of vaccine to fight the variants?
Say it again.
Does the level of side effects you have impact the ability of vaccine to fight the variants? They're really talking about your reaction to vaccines.
Yeah, no, I don't think so.
It doesn't.
That correlation doesn't exist.
No, and even the number of side effects that you have shouldn't necessarily affect the immunity that you get.
Right.
There's once again a conflict on whether to take meds like Advil before or after receiving the vaccine. Could you explain if there has been a change in guidance?
So the only guidance that I've heard, I don't know if the CDC put out anything official, but so the anti-inflammatories, the non-steroidal anti-inflammatories in particular, Advil, ibuprofen, they sort of work against your immune system. Part of what you get when you get the vaccines, you want that immune system response. So Tylenol doesn't seem to do it. So if you're feeling kind of crummy, you can go ahead and take Tylenol. But even the recommendations, don't take it before, even with the Tylenol, don't take it before the vaccine. But once you start developing symptoms later, which is generally 8 to 12 hours later or maybe longer, then if you want to take something, take the edge off it, you can take a Tylenol. But the recommendation is not to take the anti-inflammatories. I don't know that any scientific study has been done, but I think this is just a theoretical concern.
I agree. There's a theoretical and maybe some studies in animals, but just to be on the safe side.
Yeah.
Are there any other prescription medications that should be paused prior to getting the vaccine?
No, but that's a good question. If you're on a prescription medication, keep taking your prescriptions.
Would a cough as a side effect after getting the vaccine so you have the actual virus? No.
No, it's impossible to get the actual virus from the vaccine.
Right.
If you had COVID but were asymptomatic, then received a vaccine and had a huge reaction, does this show you have durable immunity?
Not necessarily.
Right. I was looking forward to getting the one-shot J&J, but many churches have significant issues about it, and they are cautioning their members not to take it if there are any other options. Is this vaccine mostly given through one type of distribution chain?
No. Well,
no, it's not, but providers have the option in ordering vaccine from the state and specifying what vaccine they're willing to accept.
But maybe we need to talk a little bit about the controversy about it, because the Johnson & Johnson came under attention because of a fetal cell line that was used in its production and testing. And that actually is true of all of them. And in fact, that's true of many vaccines that we have. Now, we've got to remember, these fetal cell lines, they go back, some of them go back to aborted tissue from the 1970s. And so the cell line, the one reason that those type of tissues are used is because they can be propagated or promulgated for decades. And so these are from tissues that was, so there's none of the tissue from that original aborted tissue that is still around. This is just, generations and generations and generations of descendants of that cell line. And the American Congress of Catholic Bishops, I believe that's the title, came out and said that the risk of COVID is greater, and so it's okay to get vaccinated. Now, there are bishops around the United States who have, within their parishes, have come out and spoken out against it, but my understanding is, and somebody fact check me, I think I have this right, but the American Congress of Catholic Bishops said it's okay to get vaccinated.
Yeah, and it's also just really important to note that there aren't any fetal cells in any of the vaccines. That's also a misconception. So people think that they're in the vaccines, and that's not true at all either.
Good point, right.
J&J shot does not include polyethylene glycol that can trigger allergies in small percentages of recipients. How would anyone know they have this allergy unless they have a previous reaction?
You wouldn't.
Yeah, you wouldn't.
Yeah.
What is the current treatment guidance for patients at home? I don't understand the question.
You treat the symptoms, right? So.
Yep.
It's just
What are early treatment protocols now for those who get the first symptoms?
Say it again?
What are early treatment protocols now for those who get their first symptoms? I guess the first symptoms of COVID.
Of COVID.
Yeah.
Yeah, I mean, I think, like Dr. Persse said, you treat the symptoms depending on your risk factors. If you're high risk for severe illness, there's a couple other treatments that you can do. Like monoclonal antibodies, there are certain treatments that you can qualify for that now they're being offered all around the city and the county. But it really depends on your risk factors. It depends on what symptoms you're showing. Because some people can just get by with just Tylenol, Motrin at home, and that's all they need. Some people need a little bit of extra support or may need to check their oxygen levels at home. And so it kind of really depends on what's going on and what your situation is.
But an important thing you mentioned is the monoclonals. So that's still, there's specific criteria for it. So not anybody who has symptoms is going to qualify for monoclonals. But if you've got risk factors and you're concerned, you should talk to your doctor and find out if you qualify.
After the vaccine, would any test prove how effective it is on you? No.
No.
Is there any test that shows the vaccine is working? What about IgG for spike proteins?
Technically, there's some tests that you can order. There's very specific ones, and it won't necessarily tell you how effective the vaccine is. Like if the test is negative, it doesn't necessarily mean you're not immune, and so we're not recommending you to get tested after the vaccine.
Have we given up on contact tracing?
No.
No.
But what would be helpful for the viewing audience is that if you get contacted by somebody who's doing contact tracing, please talk to them and tell them everything. We're getting a lot of hesitancy of people wanting to share information, and that's not helpful. So.
Yep.
And we are also looking at prioritizing contact tracing. We are going to modify our process to ensure that we're really maximizing the impact of contact tracing, and also using it to really slow the spread of the virus.
And right now that the numbers are lower, contact tracing is actually even more effective, and so we definitely want to encourage it.
Okay, seroprevalence study conducted across Harris County showed that an estimate 16% of the residents of Harris County jurisdiction have detectable antibodies for the virus that caused COVID-19. What does that tell us?
It tells us that at some point, all these individuals were exposed to the virus. Some of them may have developed symptoms, some of them may have been completely asymptomatic, but it tells us what level of the population has been exposed to the virus at some point.
Please explain innate immune system and antigen immunity in less than a minute.
Pull back your science days.
So wait a minute.
You stumped it. Okay, I'll tell you. We'll get right back to that. Well, thank you for joining us for COVID-19 Talk with local health authorities. We'll be right back.
Day after day, we set our little routines. Small things we can't forget to do, or we can't afford not to do. We embed them in our brains. We repeat. For our safety, for our family's safety. We just added a few more for everyone's safety. Remember, every time helps, every day counts. Mask up, social distance, wash your hands, get tested, don't stop, don't forget.
Oscar the Grouch here to tell you, yeah, you, to wear a mask out in public around other people. Sure, it'll keep you healthy, but more importantly, I won't have to see your happy, smiling face. And if you don't want to wear a mask, I've just got one thing to tell you. Scram! Go away!
Caring for each other because we are all in this together.
So wear a mask and have a rotten day, will ya?
Wash your hands. Avoid sick people and touching your face. There are everyday actions to help prevent the spread of respiratory diseases. Visit cdc.gov/COVID-19. Brought to you by the National Association of Broadcasters and this station.
Food. It brings us together, inspires joy, and gives us life. But we can't forget that during this crisis, over 37 million people don't have access to nutritious food. That's 1 in 12 seniors and 1 in 7 children. In fact, millions of kids aren't able to receive a free or reduced price school lunch right now. The good thing is, we can all help. Learn how you can get involved at feedingamerica.org. When we help each other, we nourish ourselves, our families, and our communities.
Welcome back to COVID-19 Talk with local health authorities. Innate immune system. Go for it.
Go for it, Dr. Persse.
All right. So during the break, I had to look that up. So the innate immune system actually is an immune system where it prevents you from becoming infected. It's like wearing gloves. It's wearing a mask. It's the plexiglass barriers. It's things that prevent the parasites, the viruses, the bacteria from getting your body. So that's what an innate immune system is. That's why it threw me for a moment. And then the other one was antigen immunity. Well, antigen immunity as a term isn't really, but if they're talking about immunity from getting vaccinated or from getting ill, then, and maybe that's what they're actually asking about is, are you better off with your immunity from becoming ill or from getting vaccinated? And it appears right now that the protection you get from the vaccine is better than what you get from an exposure. And part of it is there's no control over when you get exposed. You get a little virus and have a little reaction, you get a lot of virus, have a lot of reaction, and that still doesn't translate necessarily into how well your immunity is going to, how robust it will be, or how long it's going to last. But we have much better knowledge about the vaccine-induced immunity, and and it appears that it's stronger at this point. This is why you're hearing about a lot of people getting not a lot of people, but you're hearing some people getting secondary infections. And some of those second times they're infected, they're sicker than they were the first time.
Okay. Many with blood type A positive say that they have no reaction to the vaccine. In recent weeks, has any new research been able to correlate blood type to mean anything, or is it just anecdotal?
All anecdotal still.
Anecdotal. Yeah. My doctor said to take zinc, quercetin, vitamin C, and vitamin D3 to help prevent catching the virus and eliminate the need for a vaccine. Is there a possibility this will work?
No.
No.
And we've talked about this before. So there are a number of things that you can use for like zinc and vitamin C and so on and so forth, and they will give you some marginal increase in your immune system, but it is very, very small. And I've got 2 physicians. One of mine says use it, and the other one says it's a total waste of time. So,
and does not eliminate the need for vaccine.
It does not eliminate the need for vaccine. That's right.
So the answer to that is no. Yeah. AstraZeneca was temporarily suspended in multiple countries after really blood clots. The World Health Organization said it is not connected. Have you heard this as a part of the trials? We talked about that earlier, and you said that the blood clots are really...
It appears that the rate is about the same as the people who didn't get vaccinated. Blood clots occur, right? So.
The next question is, when will the AstraZeneca vaccine be authorized? And wouldn't it make sense to give it to countries that can use it before it goes bad? And the reason that it's saying is that AstraZeneca doses currently in warehouses in the U.S. exceeds the number of Americans. So they're thinking that we don't really need it.
Yeah,
we don't know when it's going to be.
I don't know when it's going to get authorized.
And we're not the ones that unfortunately can distribute it, but it sounds like a good idea.
The COVID tracking project is no longer collecting new data as of March the 7th. Since they were collecting from 56 states and territories, is any other entity looking at the entire U.S.? It appears that the University of Minnesota is just doing hospitalization tracking. What is a trustworthy source?
Yeah, one of the reasons that the COVID tracking project kind of paused a little bit is because the federal government is starting to be better about data, and so they're still providing some data, and the scientists that were part of the COVID tracking project are still involved. Hopkins still has really good information. Locally, you can go to our data hub.
Okay. China has found viruses in bats that are highly prevalent. We haven't heard of this research in other countries. Is anyone checking the bat population in the U.S.?
I would assume when we talk with our veterinarians, you got veterinarians, they are all over watching for pathogens in the animal world.
Yep, and I think, and I I did look this question up, and we have been looking at the U.S. population of bats, and there doesn't seem to be any relationship.
Okay, round robin. Fact or fiction headlines in the news, please comment. The CDC issued a caution against non-essential travel, even for those fully vaccinated.
Okay.
True.
All right. Convalescent plasma strikes out as a COVID-19 treatment.
It's been disappointing, yeah.
You can't beat natural immunity.
Yes, you can.
Yes, you can. The vaccine. I just said that. Actually, you said that about 4 or 5 times doing this. If you treat patients early who are over the age of 50, there is an 85% reduction in hospitalizations. I think that what they're referring to is that, at least in Texas, we know that 93% of the individuals who have died from COVID are over the age of 50.
Mm-hmm. Yeah, and that there's some therapies that they only really work if you give them really early.
A virologist in Belgium has said mass vaccinations can cause global catastrophic viral immune escape. Is this a real outcome? I don't understand that.
There seem to be saying that mass vaccination is bad, which we would disagree with.
Yeah.
Mass vaccinations aren't bad, right?
Right.
COVID antibodies are present in about 1 in 5 unvaccinated people, according to the data from the American Red Cross.
Mm-hmm.
Yes?
Yep.
That's an indication of previous infection.
Pfizer seems effective for variants.
So there's some indication of that, yeah.
It is not mathematically possible for another major surge in the U.S. at this point. What?
Yeah, so I think what they're saying there, between the number of previous infections, which is between 16 and 20%, and the number of people who have been vaccinated, which right now is about 10%, that takes 30% of the people theoretically wouldn't be likely to get. They still leave 70% of the people. There's enough room for a surge,
Yep,
I think.
I agree.
The U.S. has never been at an effective reproduction number that would allow us to control the variant.
I think we're still concerned about the variants.
Yeah, it's still too high. Our number's still too high.
Okay, B117 strain of the virus is becoming more prevalent in the U.S. Early evidence suggests that it may harm young people and women more than dominant coronavirus strains do.
Well, that's the UK variant, and it seems to be spreading more amongst younger people, but that may not be because of anything about the virus. It's just that that's where virus is spreading right now because of the behaviors.
Yep, I agree.
A study shows Pfizer 97% effective against symptomatic cases, hospitalizations, and death.
Yes?
Yep.
After the J&J shot, antibodies will increase over time.
Yes?
Yes.
Moderna and Pfizer were tested pre-variant, so their efficacy cannot be compared with J&J or each other.
Well, there's more to it than just that. So that's true. When they test them, the new variants that we're worried about were not in existence. So that's true. That's true. But in addition, and this is where I want to wait until we see the peer-reviewed articles come out. The outcomes, when they talk about people who became symptomatic stuff, those are not defined the same way between the 3 trials.
Okay.
And so there's another apples to oranges problem there.
Yep.
It's been your first show. What's your reaction to it?
It's been great. I'm so excited to be here with you guys and so excited to be here every week.
That means you're going to be joining us again, right?
Absolutely.
Tell us a little bit about yourself.
Yeah, so I'm Dr. Rivera. I'm a pediatrician and a preventive medicine physician by training, and I'm the medical director for nutrition and chronic disease prevention in one of the alternate local health authorities, and have been very involved in the COVID-19 response, especially related to schools.
Thank you for joining us for COVID-19 Talk with local health authorities, and we are celebrating 1 year of doing this. Special thanks to past President Kathy Finninger, who's in the studio with us, who provides us with these questions. This is sponsored by Rotary Club of Houston. Thank you, Dr. David Persse, Dr. Maria Rivera, and I'm Stephen Williams, the Director of the Houston Health Department. We'll see you next week.